Let's begin Part 2 of Module 3 of Alterations of the Endocrine System. Diabetes is a common disorder causing many preventable but devastating complications and is a major public health problem. Control of diabetes and its complications is a major focus for health promotion activities. No interventions are successful in preventing type 1 diabetes mellitus. For both types, we can treat through screenings, leading to early detection, which leads to early treatment, and decreases complications. So the pathophysiology of diabetes mellitus. Glucose cannot move into the cell without insulin, therefore it stays in the blood serum. That causes an elevated serum glucose. An increase in glucose causes osmotic diuresis, which leads to dehydration. The patient then will experience polyuria, polydipsia, and polyphagia. Okay, so let's talk about the three polys. Glucose cannot be passed out of the body alone. Sugar sucks up the water so that it can flow from the body. This is the result of polyuria. Loss of water through urination triggers the brain to send a message of thirst. This results in the polydipsia. When there is no insulin to funnel the glucose into the body cells, or when the insulin funnel is not working to pass the glucose through the receptors, the cells get no fuel and they start starving. This triggers the brain to send a message of hunger, resulting in polyphagia. Here's an image to assist you in learning the key clinical manifestations that can be associated with hyperglycemia and hypoglycemia. With hypoglycemia, the patient will experience shakiness, pale face, dizziness, clumsiness, nervousness, confusion, sweating a lot, trouble paying attention, hunger, tingling around the mouth, a headache, and may possibly pass out or faint. With hyperglycemia, the patient may experience going to the bathroom a lot, really being thirsty, feeling tired, feeling weak, have blurry vision, or they may feel hungry. Here are another two images that can assist you in recognizing high blood sugar and low blood sugar and potential interventions to manage the acute phase of onset. Diabetes can be diagnosed by assessing blood glucose levels. The American Diabetes Association defines normal blood glucose values in Chart 67-1 and Table 67-6 on page 1419 of your textbook. Review this chart and table to familiarize yourself with the normal blood glucose values. Some other laboratory tests that can be used for diagnosing DM are random blood sugar, fasting blood sugar, pre-prandial, post-prandial, finger sticks, glycosylated hemoglobin, glycosylated serum proteins and albumin, glucose tolerance test, and urine ketones. A test result diagnostic of diabetes mellitus should be repeated to rule out laboratory error unless the classic manifestations of hyperglycemia or hyperglycemic crisis are also present. There is no cure for diabetes mellitus. Treatment is aimed towards three goals. These goals are to regulate blood sugars, avoid complications, and minimize disruption of lifestyle. So unable to regulate the blood sugars and avoid complications and minimize the disruption of lifestyle, the treatment modalities are going to include diet, exercise, and medications. All treatment is highly individualized. For diet education, you will teach the patient the exchange system, how to do carbohydrate counting. Type 1, you want to make sure they had 3 meals, between meal snacks, and a bedtime snack, and do blood glucose monitoring. For type 2, which is generally often overweight, you want to have them reduce their calories and increase calories that are expended through exercise. You will inform the patient that exercise will help regulate blood glucose levels. It lowers the insulin requirements and decreases the cardiovascular risk. It is consistent amount of time of exercise. You want to have them check their blood glucose levels before they exercise, and then have them snack before and after. Make sure it's a protein and a carbohydrate. For type 1, vigorous exercise only if the blood glucose is between 80 to 250. This is the end of part 2 of module 3 of alterations of the endocrine system.